So yay, and I'm so glad that you guys came. Now, this is part of a healthcare reform kickoff event. Look, he's even smiling. This is a healthcare reform kickoff event that was organized for Organizing for America. All over the country today, June 6th, people are getting together and talking about healthcare reform. All we want to do is get our message out there. So talking about, you know, your birth. Why is midwifery a good thing that we're trying to kind of include in any of the healthcare reform?
My name's Dina. My husband and I have our own interactive design business. Well, I think I always just knew I wanted to be a mom ever since I was little, and like thought it was amazing that my body could do this, like, and I have to try it. But once I was pregnant and that day was getting closer, I was terrified. Like, I was really just scared. All the stories you hear, everything is sort of terrifying, and it's, you know, the most painful thing, the worst thing you're ever going to do in your life, like all this. I'm Kaiser, I'm an HMO, so I had my OBGYN, and luckily she's actually just a nurse practitioner. She's not even like an OB, which I think totally worked in my favor because she was really understanding of my concerns. She was willing to spend time talking with me a lot, and so I expressed to her my fears and stuff maybe like halfway through my pregnancy. My OB actually gave me the names of some midwives to talk to just help educate myself, and Maria was one of them. And so I interviewed midwives, and from the first moment I talked to a midwife, I was in love, and just like, this is the model of care that I want, you know, these are people that will support me. And the same thing, that you go through all this prenatal with an OB who may not even be the person, or definitely won't be the person to deliver my baby, was just so unsettling. So the thought that I could have a prenatal care provider who would also be the one to deliver my baby was so huge. So for me, that was like just a huge plus of the midwifery model of care. You know, plus I think just the women supporting women, the giving birth time, which is all it really takes, and being understanding of that is what drew me to it. And, you know, ultimately I ended up choosing a midwife and choosing to have a home birth. So that's how I sort of stumbled into midwifery, which is just like changed my life. So then I had awesome baby at home in 2005, my daughter, and it was just like the most amazing experience I've ever had, and not what I expected. I mean, I expected, like, yeah, it would be great and I'd be able to do it naturally, and I hoped I would be able to do it naturally. But when it came time, and then I did, and then the high after, and the, you know, empowerment that I really felt, that surprised me, and it just changed my life. And I say that's the day I became like a birth activist, because I couldn't believe that I had never heard about home birth or midwives before from more friends, more women. I mean, all the women I knew, all the friends my age, were just knew they were going to have epidural. Like, if I had been able to have a midwife, or even the cost of a midwife covered through my health insurance, that would have been amazing. It wasn't. I mean, I had to pay out of pocket for my experience, and my husband and I to this day say it was like the best money we ever spent, because those experiences were so worth it. But it makes me really sad for all the women who couldn't afford to pay out of pocket for that experience, and they won't have that choice, you know? That's really sad. That's why I think we need to have change.
So I'm a stay-at-home mom, and I have a bachelor's degree and a master's degree, so I would consider myself, in that sense, educated, and I have access to the resources and information around me pretty readily. However, I went into pregnancy pretty uneducated. I assumed that I would do what everyone else was doing, order the usual on the obstetric menu, let my doctor lead the process, and let him or her decide what was going to happen to me, how the baby would be cared for in utero and immediately after. And I didn't think to question why that would be, because I wasn't sick. I'm called a patient as a pregnant woman, but I'm actually at peak health, growing a life inside of me. And someone gave me a list of resources that I wasn't aware of, and I started reading some books, Ina May's Guide to Childbirth and Birthing from Within, and reading that, it awakened a sense of coming home, like, oh, there was a deeper truth inside that I didn't know was there until I read it and went, oh yeah, birth is normal, it's natural, it's healthy, women do this all the time, and healthy women may not need all the technology and the medication to have it be a joyful, healthy experience. So as I read more and acknowledged the questions that were coming into my head about my OB experience, which was hurried. There were, I think, 7 OBs in the practice. I was trying to schedule an appointment with each OB, hopefully trying to meet each single person just in case that one person would end up being there in the delivery room. And I never made my way all around it. Come birthday, went into labor. Labor went a lot faster and a lot more manageably, and I was ready to push it home. Got to the hospital, and I was, due to hospital protocol, I was told not to push when I got there because they needed to check dilation. I was told not to push because they needed to wheel me down the hall into a different specific room. I was told not to push because they needed to get an internal monitor into the scalp, which never took. I was told that I could not push in the position that I chose, which was standing. I was told to get on the table, and I started to push, and they cut me, and my daughter came out about a half an hour later, and immediately after I was joyful that I had a drug-free birth. But about a year or 2 later, I started reflecting on, what the hell happened to me? So much of hospital protocol got in the way of my daughter bonding with me. She was in the NICU for 2 days. What she needed most was my breast milk and some sun. She was in a plastic box, or she cried constantly because they were too busy with the other sicker babies. She was fed formula, even though I told her that I didn't want formula. I didn't want a pacifier. So many things about the hospital protocol got in the way of a moment of 2 human beings meeting for the first time, and I can't get that back. So undoubtedly, as long as I'm healthy and my baby's healthy, we're giving birth at home next time. I'm not subjecting my family, my children, to unnecessary intervention when we're inherently healthy to begin with. That's my story.
Wow.
Thank you for sharing.
Yeah.